Hi, I'm Dr. Nancy Carnevale. I'm one of the developmental pediatricians here at Anna Shaw. And today I'm going to be talking to you about preventing and managing meltdowns in children. And this is actually part two, and you're welcome to look at part one, which we recorded several months ago, actually. And last year, when we did the first part, we talked a little bit about what it means to have a meltdown, kind of the reasons and triggers to be thinking about. But there was a lot of information, so I divided it into two parts. So today I want to review some of that and talk again about preventing meltdowns, but I also want to talk a little bit about what to do during a meltdown, especially those meltdowns that occur in public. So I like to use the term emotional dysregulation. And because of the terms are all confusing, some people will say tantrums, some people will say meltdowns, some people will say explosions. And remember, the explosions can even occur even in adults. So when we talk about temper tantrums, where it's kind of, we generally think of a young child who kind of lets out their very strong emotions before he's able to express himself. So these are kind of developmentally expected. We know that there's going to happen. We talk about the 2-year-old terrible temper tantrums. Um, they usually occur before a child can communicate well. So this is their way of getting their point across. Um, um, they usually begin around the age of 1 and then kind of are gone by the age of 2 to 3. They often happen mostly with the parents, and the child may have some degree of control. And they often go away when ignored. And usually the child is young enough, you can kind of pick them up and take them out of the store or get them away from the situation that they're in, so they're a lot easier to handle. When we talk about meltdowns, we're usually talking about an older child, often beyond that kind of terrible 2 stage. And at that point, a child loses control to the point that they neither need to wear themselves out or the parent calms them down. And it's again, it's just this child cannot regulate their emotions, and often we see them in like maybe kids who have that are extreme, and kids who have maybe some ADHD or anger issues or anxiety. So there's a concept called the upstairs downstairs brain. Dr. Daniel Siegel writes about this. And the upstairs brain is kind of your thinking part of your brain. It's your logic part of your brain. So in a 2-year-old temper tantrum, there may be some thinking that's going on, a way of kind of manipulating you to get what a child wants. And that's kind of, again, that little tantrum stage. A downstairs tantrum is controlled by the downstairs part of your brain, which is kind of your instinctual reactions. It's the kind of the primitive part of the brain that was designed to protect us from things in our environment. It's the part of the brain that deals with breathing and thinking, and again, instinct. And it's emotional. And when it's disconnected, when the upstairs part of the brain either hasn't formed yet, because it does take a long time for that upstairs part of your brain or the cognitive part of your brain to form, or if it's just overloaded, you're just dealing with kind of pure emotion in that downstairs part of the brain. And really what's happening is the child can't use any type of logic. They can't use their upstairs brain. So there's kind of, they really just can't think. And that's when the child becomes pure emotion. They're overwhelmed and they're more extreme, and kids are really not in control of them and they need your help. So I often think of these stages of a meltdown in these stages. There's this trigger, which can be something like, we talked about it in the first version, but kind of it could be a fear, it can be a separation, it can be a noise, it can be a sensory, it could be a no, you can't have it. But knowing those triggers are important, because if you can kind of redirect when you know that the trigger is there and it's going to start to happen, that helps. Then there's this build-up phase that we have, and and a lot of parents can start to recognize that in their children. It's kind of the child may turn red in the face, they may start to see a tenseness in their body, they may have a difference in their tone of voice. And during that build-up phase, if we can get them, we can sometimes start to get them to be either redirected, let's go do something else, or we can get them to use some of their strategies of calming themselves down. So that build up phase is where we want to be able to get kids before they go into the pure emotion. Then when we hit that pure emotion, that's when the upstairs brain is not really working anymore. And you're getting that rage or that cry or that all those emotions that are just there. And at that point, the child is just not rational. And any attempt to talk to him is probably not going to work. It's really just kind of holding on to the child and letting it pass. And then we get into the slow recovery where you can start to talk to them again and they get through their meltdown. So just again, to remind you some of the triggers, knowing your child's triggers are important. Children who are hungry, so it will act up more. Carry some snacks around for you with you. Sleep deprivation, so kids who did not get enough sleep, they need a nap, their behavior is going to be worse. Sometimes kids don't tolerate being out in large crowds, or they don't like the noise of this overstimulation. It could be a fear. They're afraid of separating, they're afraid of going to a new place, they're afraid of trying something, and they may not voice it, but they're afraid, and that they're going to show it through their emotional response of a meltdown. And a lot of times it's transition or change. So children who don't like change, who have a hard time going from one thing to another, they will often go into a meltdown. So trying to be aware of those times, and again, during that build-up phase, stop it before it occurs. So you're at Walmart or you're at a grocery store and he does it again. Your 7-year-old throws that epic meltdown. His face gets red, he stomps, he screams, sometimes incoherently or sometimes coherently, in that very loud, I hate you, you're a meanie. You've seen it before. And you kind of feel like everyone's looking at you now. You're thinking you're a bad parent. You're wondering what everybody else is thinking. Is he spoiled? How old is he? He's acting like a 2-year-old? So that happens to all of us. And the important things during those tantrums in public is, one is not to take it personally. The child can't regulate. He's in a tantrum. It's not that you've done anything wrong, and you need to say that to yourself. This is not my fault, and again, try not to take it personally. And remember, the most important person in this situation, it's your child. So kind of don't be looking at the onlookers. Focus on your child. And when you're managing a meltdown again in public, the first thing you want to do is just do some type of a safety assessment. So the question is anybody hurt, or is anybody going to get hurt? And that's the most important thing. Let's just make sure everyone is safe. You can remove anything potentially dangerous from in the path of the child. Again, some children are throwers and they'll throw everything. Sometimes when they come into our office, we have to remove all the furniture and everything in the office so that until they regroup. And if you need to, you can ask for help. You can ask for somebody at the store to point you in the right direction. Sometimes, taking the child to the car if you can, if you maybe going to a family restroom, or like I said, asking the store manager, where can I go so we can calm down? During a meltdown, it's often difficult to remain calm yourself, but it's really important because kids read our cues. So try to keep your voice calm and your body language calm during that time. Sometimes you need to kind of give them a little bit of space. Make sure your child knows that you're there and that you understand that this may be scary for him. Everybody's looking at him and he can't control his feelings. So be reassuring during a meltdown. Sometimes you can turn down the lights. Again, try not to crowd your child. If you're home, your child isn't able to move, try standing off to the side, because sometimes standing in the doorway makes them feel like they're blocked in. And during a tantrum, you want to set some clear expectations. Okay, I'm here with you, and we can't move on to the next thing until you calm down. So kind of letting them know when it's time to move on to something else. Again, acknowledge your child's feelings. Sometimes you need to ignore it. There are times that you just need to just totally ignore what's going on. And then praise the behavior that you want to see. So if you say to your child, take a deep breath or close your eyes, and he cooperates, make sure you praise that behavior. Again, you want to acknowledge his anguish and be empathetic. Let your child understand what that you let your child know you understand what he's going through. So in a calm voice, you want to say, I know you're disappointed that you can't have that toy you wanted, or I know you're angry because your friends didn't ask you to play. But be empathetic and just again let him know that you understand his emotions and you're going to be there for him. Sometimes you can use some objects to help de-stress. So if you're at home during a meltdown phase, you can ask your child to punch a pillow or a cushion or something else that's kind of a soft, safe object. Sometimes squeezing a stress ball can help to kind of that to short circuit a meltdown. Sometimes you can let the child have music or play music. Sometimes having a playlist of music that he may like to kind of calm himself down. And even putting on a video now, if your child is having a meltdown over not being able to get the iPad, I wouldn't necessarily give him back the iPad to what he was playing, but you could put something else on, a different video, could be something else that's maybe somebody else who's calming down, a video of another child that's calming down, or something that they like but is not what they were playing before. So just to again distract him until the emotional state calms down. Teach children mindfulness and breathing. So there's lots of ways to do that. There's apps, but letting them have images in their mind about blowing bubbles. You can have pretend that there's a candle on their hand and pretend they're blowing out the candle. You can keep a balloon in your purse and have them blow a balloon up. Pretend they're blowing flowers. So sometimes those little techniques of just kind of now starting to control your breathing will help, again, that emotion center to calm down. There's some great apps. Sesame Street has a nice little app for little children and big challenges and teaching them again breathing, thinking with Sesame. During the recovery from the tantrum, you want to again praise the child when he's attempting to get himself together. So kind of give specifics like, I know you were really angry and it was hard for you to stop yelling, but you did a nice job calming down. You did nice breathing. So again, you want to praise any little attempt that he has to calm himself down. At home, you can create a calm space. A calm space is finding a place in your house, maybe making a tent or having some coloring books where you can color or look at different books or maybe go out on a swing. And again, the calm space is really, it's not meant as a punishment, but it's meant to be associated with, okay, this is where I can relax and get away from it all and I can start to calm myself down. Remember that children see our stress and that stress is contagious. So when parents become stressed, that stress becomes contagious. And children know that their parents are tense and overwhelmed and they will react with similar stress. So it's important again for us to take our own deep breaths during this whole thing and also and try to keep ourselves calm so the child doesn't mimic and feed off of our stress. So just a couple of other places, kind of ways to go and try things. So if we're thinking about taking a child to a restaurant, for example, and we know that they're going to have a meltdown, or they're just not going to do well there. You want to just start slow. Try to go to restaurants when things are not too busy. Rehearse what's going to happen there. We're going to get our food. We're going to have to wait. If your child is a real picky eater, you may not want them to have the restaurant food. You guys can have the restaurant food, you as parents, but maybe bring a couple things along that the child can eat. And then bring a quiet activity for your child, maybe coloring books or mazes, because he's going to get bored. Restaurants can be boring. When it comes to things like movies, again, try to know ahead of time what the movie's about and what to expect. And that way you can go over it with your child step by step. Many movie theaters have what they call sensory friendly movies where they turn the sound down or they let children get up and walk around. Earplugs can help. If you have other children, you may want to have two, and You know that you're going to have to maybe break away, maybe have another adult with you, so the other adult can stay with the children, with the other children, while you need to leave. Think about things and why we are doing them. So, are we dressing our children up to go to a special dinner for them or for us? Are we going to a ballet when a child is 5 years old because we want them to enjoy it, or or is it because we want to go? So remember, some kids are not ready. They're not developmentally ready to take part in things. We want them to experience culture, but they're not ready to deal with those kind of situations. Same thing with dressing them up. Again, we tend to like to, especially with little girls, we love to dress them up in these itchy and uncomfortable clothes, and then take them to a special restaurant or a party, and they're miserable, and they have a right to be miserable. So we have to think about why we are doing some of the things that we're doing. As a child gets older, we can teach them to kind of tell us a little bit about their frustrations. Um, Talk with your child about what getting frustrated looks like from your point of view and from their point of view. Ask the child again ahead of time, like, what should I look for? How will I know? And then come up with a signal that they can use. Maybe it's a help sign, or putting a hand on your shoulder, or something where they can start to say, I'm getting frustrated, I'm getting mad, this is too overwhelming for me. And then you can talk about what you'll do to calm the situation when they start to express that signal. You can rehearse with your child. So again, thinking about the tricky moments. We're going to a parade. There's going to be a lot of loud noises. You can put on your headphone. We can go in the back. There's going to be a lot of these fireworks can be really loud and noisy. What can we do? So you want to talk it out with the older child and try to agree on a plan. Um, again, something like going to a grocery store, talk about it. When you had a meltdown last time we went to the grocery store, what can we do now if you start to get upset? And again, if you have a plan, that helps a lot. Break things down. So kind of, if you, again, grocery stores, if it's too much for a child, but you want them to learn, start with simple steps. Like, go in and just say, we're just going to go to the grocery store and we're going to buy 5 things. Let them be a helper, have them practice holding your hands, keeping their hands to themselves, and then reward them. You did a great job, but make that a 5-minute grocery shopping. Next time, you can make it a little bit longer, 10 minutes. So you want to do these baby steps to kind of get them used to it, and so they have it as a positive experience. Morning meltdowns are, I think, some of the worst because it sets the tone for the day. So if you have a bad morning, a lot of times everybody's miserable the rest of the day, the child and you. So again, you want to kind of target things one step at a time. You can make a little bit of a schedule for your child so they know what they're going to do. And again, you work on a schedule. Let's get dressed by 7 a.m. Once they've mastered that, you set a target time for breakfast and then add on from there. So breaking things down into small steps helps them to build their self-regulation in manageable increments. So just some final thoughts about meltdowns. Again, one of the most important things to do is to stay calm yourself. Take a deep breath yourself, and use a calm tone of voice, because otherwise, if it's a shouting match, it's just going to continue and get worse. Don't hit or spank your child. Whatever you can, show your own emotions and use your labels to describe your own feelings. I was so frustrated. This is so hard for me. I just want to scream. You can say those kind of things, but then what do you do instead? And children model what they see. So you don't want to be yelling, because then they will yell back. Again, practice that empathy. I know this is hard. I'm sure you're upset. Um, but again, show them that you're empathetic and you understand, and reward the child for any attempt they use to use their own words and to control their emotions. Thank you.